Let's take, for example, perhaps any doctors that are watching who might be struggling to keep their practice open because of how pandemic has kept people in their houses, and if they didn't have something essential to take care of, they probably weren't going to doctor's appointments. What advice would you give to that doctor to be able to turn things around today?
I would say if you're a struggling practice or a practice that has experienced a reduction in the patient volume because of lack of in-person visits, or experiencing a reduction of patient volume because patients have a fear of COVID and they don't want to go to your office, then start to do your research. The video platforms out there are very plentiful, and a lot of the guidelines and a lot of the restriction has been lifted. So you can use a lot of different types of video platforms, whether it is HIPAA compliant or not. And that HIPAA compliance will come back. So you probably should choose a platform that is HIPAA compliant. In terms of billing rules, CMS is a great resource. They've just released their announcement of the new telehealth codes that will remain in effect after the pandemic is over. And most of them will remain in effect. And that's fantastic. I would say do your research in terms of your emergency response. Know that there is a way to be able to activate 911 remotely. We have a way as well. It's called telemedicine 911. We want to be able to use it as much as we can. Ensure that when you do a visit, it is safe. Be on the lookout for patients that are going to contact you that might be down the street, that might speak another language, and that you really need to have some platform in place or some solution in place so you can address those types of patients as well. And then reach out to your payers. You probably already have contracts, or you're in network with certain payers. They have a list of the codes that you can use and the modifiers. They will give you guidance on how to do it. You can be located anywhere as a provider. You might start off with a handful of visits, but then you can potentially increase to 20, 30, 15 a day. And that will be able to help bolster a lot of the care that you can deliver, help with your business, but also most importantly, it will keep your patients in good health, their prescriptions refilled, their tests done, and their health optimized. So it's one of the things that you probably should do as a provider that cares for your own patients.
I have another scenario. It's just a conversation that I have. So we're dealing with problem, for example, someone who coordinates telehealth visits and in person where an interpreter is required. If they have someone in their home that doesn't speak English, it's even more complicated because they can't download the right app. Just to summarize the challenge that they see, it's not being able to get the tech stack right. It's the hardware stack right, in essence, to be able to provide the access their patients need. What went wrong in this scenario? Why are they struggling for years to get patients what they need?
Yeah, so it sounds like, Jeff, the problem you're asking about is patients, and the episode of care is having a lot of tech problems. Tech problems with the visit itself, or tech problems trying to get a third person to translate. And I would say that those are problems that should be easily solved. We do multi-person Zoom visits, Skype visits all the time, even FaceTime visits. Most of the video conferencing software out there that we're using can handle multi-person visits. And you don't need anything extra or any special software to do it. Most of the video conferencing softwares that we're using today, you just click and you get right in, whether you have an app, you've downloaded something or not. And I would have to say there are a lot of legacy programs out there that require an app. We're in 2020 right now. You don't need to have an app to be able to do a three-way conference between a patient, an interpreter, and a doctor.
My take on it is there's been a lot of focus the wrong way around. And certainly I don't have the view and experience as you do as a doctor, but I've seen just as a patient, I use a system here for my local provider that, I'm pretty tech savvy, was able to get on the Zoom call with you, no problems. But for some reason, I was 4 appointments in before I could even figure out how to access this specific portal that they designed for this large health system here in Cincinnati. And it was four visits in and before I could actually do it instead of just the phone. Wouldn't we all benefit from thinking of it the other way around, from the patient up?
From the patient up, I would say you're exactly right, Jeff. And I would say that in this sense, the smaller practices have the advantage. So if you are a small practice and you're the only doctor there, and you're searching for a handful of different types of platforms, and you're going to look at 3 or 4 different video conferencing platforms, you're going to probably want to experience it from the provider side and from the patient side and know what's going to be the easiest. And you're probably going to make a decision relatively quickly. They have an advantage over a lot of larger health systems that might take 6 or 12 months to be able to make a decision and then integrate it and then have that be active. And a lot of the health systems today, right now, are still using legacy systems that they installed 4 or 5 years ago. And unfortunately, even though they might be a giant system, you think they have the best technology out there, they're less nimble to be able to adopt to the best technologies as the best technologies come out.
Thank you so much for your participation so far. One more that I know is a sticking point. Well, let's say a complication for a lot of the clients we work with is if you are driving it from the patient side, how do you track the requests? How does payment get handled? I mean, how do you centralize some of these things that also might be too complicated right now? And when you add in the element of having the interpreter on a call, just language access become even more complicated, what can you say about some of these administrative side things that are ailing providers
Right.
today?
So there's again on there's a dichotomy between what small practices are able to do in terms of 1 or 2 doctors, and then a large 50 to 150 physician practice or health system. So if you're a small practice, it'll be easy. You just do the visit, and then the administrative process flow is the same person. It might be one other billing person, and you don't have very much to coordinate. What I find on the other side, and really what Air Visits deals with more so, is high volume telemedicine. How are you able to manage the process flow? Are you going to be able to use the hub and spoke model or other types of models to be able to filter in the different steps or processes that are involved in managing a plethora of visits and all of their specialty consultations? The way we do it is we supply the call center to be able to do so. All of the software, tracking, queues, different methods to be able to manage hundreds or thousands of visits in a day. And are you able to do it with a blend of software and also additional staffing? We're one of the companies that offers the call center to be able to get a large scale telehealth practice up and running at high scale day one. Others offer similar types of solutions, but it all depends on what is your goal. If you're looking for feasibility that you can do, maybe 5 or 6 completed patient encounters over telehealth, most providers can do that, even at a large institution. If you're looking for scale, not feasibility, if you're looking for how to process thousands of visits a day, then it's probably better to be able to build a staffing and technology infrastructure.
So that's interesting. Let me see if I got this right. I have a small practice, right? Maybe I'm ambitious. Maybe I started to make the transition to more video visits, telehealth, your favorite term you pick. I've been investigating the possibilities. I want to grow my practice a lot. Are you saying that making the shift to sort of make a business shift and a paradigm shift to help thousands of more patients, even if you're in like a small town in the middle of the country?
If you're a small practice and you want to be able to build a telehealth operational infrastructure, a small practice could do it just by getting some video conferencing software like Zoom, something free, something paid, that's inexpensive, and you're going to be able to do it at a small volume. If you want to build a large scale telehealth practice, you're going to need a lot more providers, a lot more staff, and that's when the infrastructure need increases tenfold. Is the difference between doing 10 to 15 visits a day to 1,500 to 2,500 visits a day?
Okay, so before we leave, we have to do one more thing. We're going to get a tour, front row of the Air Visits headquarters. So Alex is in the field, or on the floor, you could say, about to show us where the action happens.
All right. So this is our telehealth center. We have a lot of what we call patient care associates and providers that are in each of our stations that are managing patients. And this center over here, it's around 30 people large. We have those screens in the back are metrics to be able to manage a lot of the operational flow, and also what is the number of patients that are coming in, how many are getting processed, what needs to be followed up on, what are all the exams that need to be done, all the testing needs to get done, and also the clinical measures for diabetes, for high blood pressure, heart disease, all different types of clinical metrics too. The purpose of this control center is really to reduce the top 10 causes of death and identify those ailments that need to be optimized. And then now this is the army of people that talks to hundreds of patients a day to be able to manage their initial care.
And it's amazing. I mean, what blew my mind today is just I'm learning that you can do so much more than I thought remotely. So that's really cool. I mean, so many of us probably thought, if as long as it's just talking to somebody, you can do a video appointment. But nope, you can do so much more care remotely. That's amazing that you guys coordinate that.
All right, great. Thank you so much.
Thanks for the quick tour, Alex. All the things we talked about today, I think there's a ton of middle ground that we explored, and so I'm really grateful for that. And so more than me being grateful, the patients that you and I ultimately are serving will be really be able to benefit greatly from what we've talked about here today. Real quickly, how do we get a hold of you?
For us, if you just go to airvisits.com, that's our Air Visits website. If you are interested in anything about telemedicine 911 and being able to activate 911 remotely for patients that are in different cities, then that's just telemedicine911.com as well. You can reach us there.
Excellent. I'm Jeff Weiser from Ad Astra Inc., Head of Client Solutions. Alex, thank you so much. I'm really fortunate to have this partnership with you, and have a good weekend.
All right, great. Have a great weekend too. Thanks.
All right.